Receiving a kidney transplant is a life-changing event, offering a second chance at a healthier life. However, the journey doesn't end with the surgery. To ensure the new kidney functions properly and isn't rejected by the body, transplant patients must take lifelong medications to suppress the immune system and prevent complications. The idea of taking multiple medications daily might seem overwhelming, but these drugs play a crucial role in protecting your new kidney and keeping you healthy. Some medications help prevent organ rejection, while others manage side effects and related conditions. To help you understand your post-transplant treatment, here's a list of the top 10 medications commonly prescribed for kidney transplant patients. We'll break down how they work, their benefits, and potential side effects. Number 1. Tacrolimus. Prograf, the key immunosuppressant. Tacrolimus is one of the most important anti-rejection drugs for kidney transplant patients. It works by weakening the immune system to prevent it from attacking the new kidney. Patients usually take tacrolimus twice a day, and blood tests are required to ensure the dosage is right. While effective, it can cause side effects such as high blood sugar, kidney toxicity, and hand tremors. There are different formulations of tacrolimus, including Envarsus XR and Astograph XL, which are extended-release versions that only need to be taken once a day. Number 2. Mycophenolate mofetil, Cellcept, supporting immune suppression. Mycophenolate mofetil is often prescribed alongside tacrolimus. It prevents white blood cells from attacking the transplanted kidney, reducing the risk of rejection. While effective, common side effects include nausea, diarrhea, and an increased risk of infections. Patients taking mycophenolate should be mindful of their immune system's vulnerability and take extra precautions to avoid illness. A different form, Myfortic, is an enteric-coated version that may be gentler on the stomach. Number 3. Prednisone, the steroid backup. Prednisone is a steroid that helps control the immune system, especially in the first few months after transplantation. It is usually given in high doses immediately after surgery, then gradually reduced over time. While it's effective in preventing rejection, long-term use can lead to side effects like weight gain, high blood sugar, mood swings, and bone loss. Because of these risks, doctors try to taper prednisone down to the lowest effective dose, stop it altogether if possible. Number 4. Cyclosporine Neoral Gengraph, an alternative to tacrolimus. Cyclosporine is another immunosuppressant that works similarly to tacrolimus, but is used less frequently due to more side effects, including high blood pressure and kidney toxicity. However, for some patients who cannot tolerate tacrolimus, cyclosporine can be a good alternative. Regular blood tests are required to monitor drug levels, as too much cyclosporine can be harmful, while too little can lead to organ rejection. Number 5. Everolimus Zortris, a newer immunosuppressant option. Everolimus is part of a class of drugs called mTOR inhibitors, which help suppress the immune system while also reducing the risk of certain cancers that transplant patients may be prone to. This medication may be used in place of tacrolimus or cyclosporine in some cases. However, it can slow wound healing and increase cholesterol levels, so it is not the right fit for everyone. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Sirolimus Rapamune, another mTOR inhibitor. Like everolimus, sirolimus is an mTOR inhibitor that helps prevent rejection. Some doctors use it to reduce reliance on tacrolimus, which can help minimize kidney toxicity. However, sirolimus is not typically used right after transplant surgery because it can slow down healing. It is more commonly introduced later if other medications are causing unwanted side effects. Number 7. Azathioprine Imuran, a backup immune suppressant. Azathioprine was widely used before mycophenolate mofetil became more common, but it is still prescribed for some patients who cannot tolerate newer medications. This drug works by suppressing white blood cell activity, but it can increase the risk of infections and lower blood cell counts. Patients on azathioprine need regular blood tests to monitor for complications. Number 8. Belatacept and Nulogix, a monthly 4 option. Belatacept is a newer alternative for transplant patients who want to avoid daily pills. It is given as a monthly IV infusion, which can be a great option for people who struggle with medication adherence. One major advantage is that belatacept is easier on the kidneys compared to tacrolimus or cyclosporine. However, it is not widely used yet, and patients must go to a clinic for each dose. Number 9. Bactrim, preventing infections. Because transplant medications suppress the immune system, patients are at higher risk for infections. Bactrim, sulfamethoxazole, trimethoprim, is an antibiotic commonly prescribed to prevent pneumonia and urinary tract infections in the first few months after transplant. Some patients may take alternative antibiotics like dapsone or atovaquone if they are allergic to sulfa drugs. Number 10. Valganciclovir, Valtite, fighting viral infections. Many transplant patients take Valtite to prevent cytomegalovirus, CMV, a common virus that can be dangerous in people with suppressed immune systems. This antiviral medication is usually taken for 3 to 6 months post-transplant, but may be continued longer in high-risk patients. Side effects can include low blood cell counts and nausea, so doctors monitor patients closely while on this medication. A kidney transplant is a life-saving procedure, but it comes with the responsibility of taking daily medications to keep your new organ healthy. Immunosuppressants like tacrolimus, mycophenolate, and prednisone help prevent rejection, while other medications manage infections and side effects. Each patient's medication plan is unique, and doctors may adjust prescriptions based on how your body responds. Regular checkups and blood tests are essential to ensure the right balance of medications. While managing multiple medications can feel overwhelming, the key is to stay informed, follow your doctor's advice, and never skip doses. If you ever experience side effects or have concerns, talk to your transplant team. They can help find the best approach for you. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.